Now, I want to pick the areas that people say are where we have the biggest problems, just to demonstrate why I think we are making important progress. So let me pick another one that regularly crops up where we absolutely do have a lot of challenges, and that is mental health. Now, mental health has always suffered under successive governments from being the Cinderella service. It suffered from the fact that they've never had waiting times targets, which has sucked money into other parts of the NHS. And it's often been the first call for cuts when people have run out of money. And so there have always been issues there. But let's look at what has actually changed in mental health, again, over the last 6 years. If you look at talking therapies, which is, by the way, the new word for IAPT. We are officially banning IAPT because we think it's totally incomprehensible. But talking therapies is often the first line of treatment for people with depression, anxiety, and those conditions which, if we catch early, we can stop being a lifelong condition. In fact, the exciting thing about talking therapies is how high the total cure rates are. And we are now seeing 750,000 more people accessing talking therapies every year. There is a huge ramping up. If you look at dementia, another illness which people have often not wanted to talk about, it's often had a lot of taboos around it. We have moved from diagnosis rates that were around international averages to the highest diagnosis rates that we can find measured anywhere in the world. We have 1 million dementia friends, second only, we think, to Japan. We are taking mental health as a whole, seeing every day 1,400 more people for mental health treatment than we were just 5 years ago. And on top of that, we've legislated for parity of esteem, and we've introduced waiting times targets for psychosis, talking therapies, and eating disorders. But again, we know that's not enough. The world has only just woken up to the power of effective mental health treatment. And so we've had the Mental Health Task Force reform, brilliantly chaired by Paul Farmer, that is proposing some more changes we can make, including a transformation of children and young people's mental health, which is still an area we need to do a lot of work on, plans to spend $1 billion more every year and indeed treat 1 million more patients every year. And on top of that, in the next couple of months, NHS England will be publishing, this is the first time it's happening anywhere in the world, CCG by CCG, Ofsted-style rankings of the quality of mental health care, so we can start to even out the variation. So really ambitious plans on mental health.